a 46-year-old patient who's otherwise healthy came in frustrated. Every few months she gets a bladder infection. And she said, this is horrible. I mean, I don't even know when it happens and it just hits me. And then, man, I am living in the bathroom. It's crazy how quickly it comes and how horrible the symptoms are. And I'm so afraid I just cannot live with this anymore. What therefore constitutes frequent bladder infections? By definition, it's more than 2 infections which are culture proven in a 6-month period or 3 infections in a year. That typically constitutes recurrent bladder infections or frequent bladder infections or frequent UTIs. Now, it's not a hard and fast rule, but if someone has had these infections and she's really bothered by it, then I'll start working on it and say, okay, let us see what we can do to prevent so you don't have to live with this. So first and foremost, we make sure that this is truly a bladder infection. Once it's confirmed that yes, it's a bladder infection, then we look at her overall medical history. How is her overall health? Does she have any risk factors? Is she a bad diabetic with a high hemoglobin A1C? Is she morbidly obese? Does she have any immune suppression disease? Is she taking any steroids for any medical conditions? Anything that affects her immune system? Then locally, does she have any atrophy in the vagina? It means, has she gone through menopausal changes that could cause bladder infection? And I'll explain later. What about does she have a prolapse? Is the bladder falling out? Does she have difficulty emptying? And does she have urinary retention as we do the bladder scan? Then we may also look inside the bladder and make sure the bladder looks all right. And if necessary, do an imaging study for the kidneys to make sure there is no kidney or upper tract disease. So this is the full evaluation that needs to be done to make sure that there is nothing underlying that's causing the frequent bladder infections. Once that is assessed and there is nothing underlying, we can then institute appropriate treatment, as I shall tell you subsequently.